we start? All right. Great. Okay, before we start, we always tell you this. Our vision is to be the Malaysian #1 pet health academy, which we are doing now. I think we are the first, and we want to be always #1, providing you the best pet health information from the medical side, okay? And definitely we want to educate 10,000 pets owner in these next 3 years on pet first aid and transforming pets owner to be pet hero by educating you so that you know more, okay? One more thing that we want to congratulate is the new batch of cats and dog CPR certified first aider. Yeah, give you guys a round of applause because it's not easy to go through it. Some of them, we kind of delay their pass and all that. Those that pass, we also always, wanted them to come back to relearn and recheck because the life of the pets is actually in your hand. All right. So, okay, let's not delay further. Why we do what we do is because, first of all, especially for kidney patient, yeah, I would want to tell you how I face in the clinical setting is that people might come to me. Don't talk about SDMA. Cats that comes to us and dogs that comes to us at the age of having all this creatinine and urea being very, very high, and then we can't do anything because it's kind of too late. Okay, so why is it too late? Is because client did not pick up the signs and symptoms fast enough. Okay, I have been telling these signs and symptoms many times. Okay, I won't really repeat it this time because I'll just go through very briefly because I want to teach you a lot more about something deeper. So please prepare. Okay, please don't fall asleep. Please be prepared that today's content is a bit heavy and a bit deep. All right, so I think you can handle it. All right, so there are two types of kidney disease mainly. Okay, acute kidney disease means something coming very fast. Okay, what can cause acute kidney disease is like poisoning lah, like your grape poison, when they eat grape poison. And then after that, what else? Kidney stone that get blocked in the ureter or inside the kidney. Okay, if the kidney stone is in the kidney, doesn't cause much problem because it's there, doesn't stuck anywhere. Then eventually, in the long run, it might cause chronic kidney disease. But if it is the stone that actually block at where the urine supposed to produce and flow, then you will have this acute kidney disease. Very sadly, I think a few months ago, we have a cat that is really sick, and then the creatinine, it's up to about 1,200 when we see the cat, and the normal is 200 plus. Okay, normal is about 200, less than 200, but for that cat that comes to us is 1,200. So to be frank, we can't do much, but actually she is being diagnosed like not able to do much, need to put down and go back home. But good news and bad news when it comes to us, it's really bad. But we found that a stone that actually stuck in the kidney. To be frank, removing the stone when the cat is slightly, better in the early stage, we can actually remove the stone and the cat would be okay. But the problem is because the issue is so bad, going in for surgery is very dangerous. So it took about 2-3 days for the creatinine to come down from 1,002 to about 900 or so. We went in for surgery. The cat passed through the surgery. she's very, very strong because she's a 4-year-old cat, only a 4-year-old cat. She's very strong. She passed through the surgery, was well, but then she passed away, I think, about 2 days after the surgery. So I think she cannot really take the anesthetic very well because the toxin in the blood is so high. Okay, so that is something that we want you to know and pick up fast lah. Okay, chronic kidney disease is more like, chronic means very long time. Okay, very long time, and this kidney disease usually caused because of age, because of degeneration, or because of diet and all that you have been not feeling well, too much, maybe too much of phosphorus, too much of nitrous that inside the food that actually cause this burden in the kidney, or drugs, medication that you have been giving, you know, or skin problem so bad that we have to give medication all the time. Maybe all the other medication that can actually cause the kidney to work harder in the long run, this will also be able to cause the kidney issue. So whenever you are giving medication, right, it's not that every medication will cause kidney problem, but the thing that the medication can, certain medication can cause this. Okay, so I'm going to run through this with you. Okay, what is polyuria polydipsia? I'm going to quickly run through this. Polyuria polydipsia means you see your cats or your dog are drinking a lot of water and peeing a lot. Okay, that's one. And then your cat can be eating or not really eating, but having weight loss, especially muscle loss. Okay, all right. And then poor hair quality. Why poor hair quality? It's like, it's not that only the hair doesn't look very good, but the hair looks like it's standing up a bit. You know why? Most of it is because the cat or the dog, it's having a bit of dehydration that you didn't know. Okay, can anyone tell me how to test hydration in a cat or a dog? Okay, put in the chat. What are the medicine that can cause kidney failure? There are quite many, especially NSAID. Please don't use human medicine that it's taking care of pain, like painkillers. NSAID means non-steroidal anti-inflammatory. So anti-inflammatory is quite bad. Okay, and then any other some of the antibiotic can cause kidney failure. Not all. Poison like lily can cause kidney failure in cats, and then grapes can cause kidney failure in dog. Avocado can cause kidney failure in dog. And then, no one want to answer me. Who wants to? All right, thank you. Pinch the neck skin. Okay, you let go. If it comes down very fast, within 1 second, then the hydration is okay. Okay, if 1 or 2 seconds, then only the skin slowly come down, that is dehydrated. Okay, so you can actually now go to your pet and pull up the hair around the neck to see. Okay, later if we have time, we'll get more and then I'll show you. All right. Halitosis. Halitosis means the breath. Halitosis is like a sour breath. It's not really like smelly, but it's sourish. Okay, most of the time, why is this breath so-called sourish? Is because there's a lot of urea in the blood that is deposited in the this digestive tract. That's why it's caused ulcer. Remember, I say mouth ulcer, throat ulcer, even gastric ulcer can caused by this kidney failure. All right. Inadvertence, why? Because there's so much of toxin in the blood. Do you still feel like eating or not? All right. All right. And then mouth ulcer is definitely tongue ulcer as well, mouth ulcer as well. And then lethargy. Lethargy means very tired, keep feeling very tired and depressed. Okay. I'm going to answer your comment in the chat box now. White or gum and all that, you don't really check hydration on gum. Okay. Hydration, gum color and gum CRT, you always check for circulation. That means how fast the blood is, okay, to replace. But the what is this called? The neck hair, the neck skin, you pull it up and let go. That's where you do the, how to say, the dehydration. All right. Okay. Are you guys okay so far now? Any one of your cat has this problem? No? All right. So anyone can understand until now, put 1. Okay, whoever that cannot understand me, put 2. Great. Okay, next. Okay. So when you go to the vet, right, the vet will definitely start asking you, okay, start asking you that whether what is the treatment option that they will go through, okay? So usually before you want to proceed, we always stage the disease. What do you mean by staging the disease? Okay, so whatever that the doctor tell you, you will say okay to it, right? Usually like, oh, I ask you to go through this dripping process, then you will say yes and go through it. But we want you today, we are going to teach you by the national standard on how we stage this, okay? So when you go to the vet, you can actually see whether they are doing this to your pet or whether you can actually ask for this test. Sometimes the vet, it's not that the vet don't want to tell you to do all these tests, but you have to bear in mind that each and every of these tests cost money, all right? And it's not cheap. Our blood pressure machine, the one that you can buy from the pharmacy for your own use, right? Okay, you can get it by what, 200 or maximum 500, 600 ringgit. You can get a very good one, right? For human BP machine. Okay, but I want to tell you the BP machine that we use for the pets easily cost about 6,000 to 7,500 for one machine. Okay, even a second-hand one might cost about 5,000 ringgit. Okay, so for the vet actually to invest and get the nurses to do it and all that, it's probably not easy. And SDMA, just now someone were asking and tell me about SDMA figure and all that. It costs 100 over ringgit to test SDMA as well. All right, so now if you really concerned and it is in your budget that you can actually spend the money, I think you should actually ask your vet about it, and then you see whether you can get it. You can actually get the thing done. All right. So okay, we're going to go to a very, very difficult kind of difficult chapter. Okay, so what we are trying to do is that when we want to stage, when we want to do iris staging, right, then we are looking at a few things. First is the creatinine and also the SDMA. Jamie asked, will fasting or not fasting affect SDMA? Usually no. Okay, the answer is usually no, Jamie. So normal blood creatinine that is here is about dog 125, cat, you can actually take this one in, or you can actually take a photo of this, or you can actually go to Google and take down this and key in this iris staging, then this thing will come out, okay? Then you can have this reference. So SDMA, it's always, we wanted it to be less than 14 is the best, okay? SDMA. SDMA is just, okay, I'll put it in a very simple way, okay? Let me put it in a very simple way. So we don't look at this first. Whoever that actually taken this photo, just take this photo. I will want to be up so that I can tell you in a very simple way. All right. So can you guys see me? Now, what you can imagine, you have 2 kidney, right? 2 kidney. And then, do you know that you only need 25% of your kidney to work? Whoever that knows this, put yes, 1. And then whoever that doesn't know, put 2. Okay? For human or even dogs or even cats, you only need 25% to 30% of your kidney to work, to be able to live like a normal person. Okay, you don't even feel drowsy. You don't even feel like there's toxin and all that. All right. So that's why when people say that, oh, I need to donate one of the kidney out for my brother, let's say, you can take the whole kidney out, transplant it to another person, and that person still live very happily. Okay, does it make sense to you now? That's why you can actually donate the kidney, right? So the other kidney that's supposed to work, okay, you only need about half of that to work. Whenever you do blood tests and then they tell you, okay, the serum creatinine or urea is high. When these 2 things is high, these 2 things are toxic to the body. Usually when you eat, right, they process the food. Urea, creatinine, and phosphorus, all these things are being processed and then being pushed out from the kidney to the urine. And then the urine take out is where the toxin is. So the kidney inside, right, there's a lot of small filter like this. You know, it looks like this. Okay, it looks like this. And then the vessel comes in with all the toxin, and then it goes through this sieve, and then it go out as a clean blood. So this one acts as a filter. Whatever that goes in here with the pressure, it comes out as the urine with all your toxin. Okay, so the clean blood go outside and circulate in your body again. So now, when the kidney don't function well, when the blood come in with the toxin, it doesn't get filtered through. It doesn't go to the urine. So where it goes? Ask you where it goes. Come, Prem? You were answering. You actually, where does the toxin go? If it doesn't go through the filter and then go to the urine, it stays in the body. Thank you, Mr. Yi. It stays in the body. Why? Because it's still in the bloodstream. Yeah, it backs to the system, like Prem says. It just go round and round. Okay. And when this toxin, you know, this much doesn't get pushed out, it accumulate and accumulate and accumulate. So when it all accumulate, this toxin is the one that we test in the blood. Okay, so let's bring back up that slide, right? Then you will be able to see the creatinine is actually having this 125 and 140 is where your creatinine is. All right, usually it's below this because it gets pushed out to the body. All right, that makes sense. So imagine SDMA, so whenever creatinine start going up, meaning to say that less than 25% of your, at least less than 25 or 30% of your kidney is working already. Okay, until then, you will start knowing. And because of this toxin is being circulating back in the system, then only your cat and dog will feel sick. Then they will feel like they want to vomit. Okay, vomiting is also one of it that I didn't put in because is too many. And then one of it is because it's vomiting because the toxin is in the blood. Okay, so they feel so bad, they feel so drowsy that they feel like vomiting and don't feel like moving. That's why they are so lethargic, they're so depressed. All right. So imagine SDMA. You don't really know what SDMA stands for and all that because there's no use of knowing it. But what SDMA does in this situation is that it is a parameter that you can actually detect, okay, detect the kidney doesn't work well before you hit the creatinine and urea being high. Okay, so put it in a very simple way, means that now even if you only left like 60% of your kidney is working, the SDMA already detect it. And they also want to know, because sometimes creatinine high, urea high, it's not necessarily a real kidney problem, you know. All right. Sometimes it's because of dehydration of other things. Okay. But you know, when you are having that, you don't know that whether it is real kidney problem or not. So then you do the blood test for SDMA, then you will confirm if this is it. This is a kidney issue. Understand? So very early we'll be able to know that whether it's a kidney problem or not. So if the urea creatinine is nice, is good, but you see that my cat like a bit inappetence there, then going to toilet a lot more often. But the urea creatinine was at the borderline like 120 like that, you know, 120 for cat, maybe like 100, just about 130, 140 or 120 plus. So what you want to do, let's say you're very kanchiong owner like me, you will want to do SDMA, because then you will know that whether, maybe at that point of time, urea creatinine is normal, but the SDMA already go up to 18. All right. So in that case, you can already know that, okay, I'm at the stage 1. Okay. Anything more than 14 at the SDMA, but less than 18, will still categorize them as 1. So sometimes the creatinine and all that is still low, is still looking fine, but then, well, you don't know that it is a issue yet. All right. So now you can understand, yeah. So next, why blood creatinine has 2 figure? Because sometimes your doctor will use this micromole per liter, or sometimes your vet will use milligram per deciliter. So this is the thing. So this is how this is where your sorry. So this is where your creatinine reading are. Okay. If your vet, now if you have your blood test with you, this is the one that is the milligram per deciliter. Okay, don't worry. If I say 100 and over here, you see, no, my cat very good. Then why my vet say my cat has problem 1? Because probably is a different reading. Probably is this 1.4, 1.6. All right. So definitely stage 2, following this 125 and all that. Okay, and we can see the next slide. So if I make it like that, would you be able to understand that this is how we stage the CKD, I mean chronic kidney disease? You can? All right, great, 真好. Only 1 person know. Okay, sorry. Okay. Right. Just now Jimmy was saying Can you hear me? Alamak. Can you hear me now? All right, great. I'm answering Jamie's question just now. That she says for creatinine, right? If you are fasting or non-fasting, sometimes fasting, non-fasting creatinine level might, because like I told you, it's from the food that they actually process and create this creatinine level. But usually SDMA, no, not at all. Okay. The factor that affect SDMA value. So SDMA is quite a specific marker. So SDMA is very specific to kidney. So let's say sometimes, right, urea reading can be altered if your cat is dehydrated or your dog is dehydrated. Sometimes urea can be very high. Okay, but it can be dehydrated because he's vomiting, not eating, or having diarrhea for a few days. So then the urea level will be high. Creatinine level may be, all right. But SDMA value, it's always quite specific to kidney, all right. So when you are at the borderline, like you say, creatinine is high, but the SDMA value is normal. If your SDMA value is at about 14, right? Let's say about 14, then you have to concern also. Maybe it's an early issue. But let's say your SDMA level is 10, but your creatinine is slightly high. Then it could be some other issue. It could be a blockage issue, that instead of a real kidney issue, it might be that the bladder is blocked a little bit. That's why always the urine cannot produce and being pushed out properly. Some blocked cat and all that can cause this problem as well. Some stone problem in male dog can also cause this problem, that your SDMA will be lower. All right, will be lower. All right, great. I'm almost done with this staging. That's one more thing that I need to tell you. All right, blood pressure. Okay, blood pressure. What do you need to do? Like just now, you need to do the creatinine level, so urea creatinine level. And then after that, you need to do your SDMA level to stage that. So just now, you all have taken the photo or even can download it from the Iris staging website. All right. And then blood pressure. Who can tell me what's the normal blood pressure for cats and dogs? Anyone? It's actually very similar to us, lah. But when they are, especially cats, when they are, how to say, when they are a bit dehydrated, right? Or in the clinic, they might be a bit higher, all right? They are actually like us. I see whether you can get it from the Google or not. So dog people, tell me what is dog normal blood pressure, and then cat can tell me what is the normal pressure for cats. Okay, so 120 to 140 it's reasonable. Okay, yeah, Jamie, your pet having CKD, is it? You read up a lot, Jamie. Great. I'm glad that you know. Great. So 110 to 60, if it is in the vet, we will consider that as a bit too low lah, if your pet is in the vet. Okay. So usually in the vet, will be about 130, 140. So 140 usually in the vet, it's very reasonable. But by paper, we will still take 110, 60, 160, 90 to be normal. All right. So there's a lot of cats and dogs. Okay. They are like human too. Okay. Oh, they are like human too. when they have kidney disease, they will have high blood pressure as well. And when they do that, they will also affect the heart. Okay, so that's the reason why it's very difficult for you to do the blood pressure at home, because like I told you, the blood pressure machine is very expensive. It's quite not impossible, but quite crazy that someone wants to actually take the blood pressure at home every day for their pets, and then invest on the 6,000-7,000 machine. Okay, so the 6,000-7,000 you can do so much more for your pets lah. So coming to the vets, if the level is around 140 to 160, it's fine. So it's like us, the systolic pressure is the up one, the diastolic pressure is the low one. Okay, so when you do this, we also look into the heart rate as well. I think I have taught you before how to actually measure the heart rate, right? Okay, please measure the heart rate as well. Sometimes the heart rate is too high, then the blood pressure can be a bit lower. Okay, okay, up till now, anyone has any questions? Okay, now we want to ask you guys, right? Let's put a poll on to see that who actually give commercial diet and who actually cook for their pets. All right, cook means you home cook or you buy home cook. How to measure heart rate for dogs? Okay, usually I think pulse rate will be easier for you guys. I'll see whether I have Xiao Bai here. Might need later. Yeah, later I might need Sabrina's help to get us the Xiao Bai and teach you where to do the pulse rate. Okay, okay, then you can please put whether you are feeding on commercial diet or cooked food. What? Buff and home cooked, buff and blueberry as treats. Okay, so quite a lot of you actually use both. Yes. Okay, this is Xiao Bai. Hi everybody, this is Xiao Bai. Okay, whoever that comes to a class know who Xiao Bai is lah. Okay, do the poll and then I'll teach you how to take the pulse rate from the dog. Okay. Hi Cheryl. Cheryl, say hello to Xiao Bai. Xiao Bai has been very popular these days because the physical first aid class is on. So Xiao Bai is in use. I think you can see it in the video, right? I think some of the Xiao Bai get ripped off so badly. All right. So, okay, for whoever that asked me the question just now, how to take heart rate, right? Usually I think, or the CPR class student has told me that the pulse rate is easier to take, which I kind of agree. Okay, so this is the thigh, this is the back leg, the back leg. Inside the back leg, in the middle, right in the middle here, there is a vein called, there's an artery called, who can tell me? Okay, who tell me this? I give you, what do I want to give you? I give you one DMG, small DMG. Wow, this time, okay, who can tell me the first one and the answer? I'll tell you. The artery. Wow, so pandai lah. Who is this? Yamuna. Well, Yamuna is a new student. Wow. Thank you, Bernice. Thank you, Cheryl. Okay, femoral. And she got the, yeah. Syphilis is down here. Syphilis is down here. Usually we can't really feel it. Okay. The one that up here is the femoral artery. Okay. Femoral artery, you don't really have to remember the name lah. I'm just joking. But who is that just now? Yamuna. Later you please text Sabrina to claim your gift, yeah. All right. I'm not going. I'm gonna honor my word. So you use two finger like this. Two finger, go through here, go right in the middle. If your pet is with you, please try that. Okay. So at the end, at the end, you will feel this in the middle, and then you see whether you can feel the pulse or not. All right. If you really want to feel the heart rate and your pet allows you, then what you do is the left side of the dog, you pull the leg, right? You pull the leg. So difficult. You pull the leg up, and where the elbow is where the heart is. Okay. So the leg, you do like that. You hold it up this way. The leg is straight now, right? You hold it up to the chest. That's where the heart is. Okay. It's exactly here. If your cat or dog is not fat, if it is not too fat, then you can feel it. Also put your two finger there to see. Okay. So Daphne says dog susah get her heart rate. So that is why you need to learn how to do the heart rate and then take it before you go to the vet and tell your vet what the heart rate is. Okay. But please do it nicely. Do it nicely so that your vet will know that whether you're telling the truth or not. All right. If you go and tell her that your dog only have 48 beats per minute, you think your vet will trust you or not? So what's the normal heart rate? Come tell me what's the normal heart rate. Yes. How you count the pulse or beat? Okay. You count the pulse or beat, that beat, right? Each time that it touches your finger, you count one time. Okay. And you count 15 seconds. Okay. Let's say you get 6 times on 15 seconds. Okay. Then you times, let's say you get 10 times on, how many times you should get? Let me see. Let's say you get 15 times on the 15 second. Let's say each second 1. Okay. Then you will get 60 beats per minute. Oh, all right. Great. Very good, Cheryl. Small dog always have higher heart rate. Okay. Yes, 80 to about 120 for small dog, and large dog about 60 to 90. Yes. All right. Great. Cats, you're right. Cats can be very high. Cats, 120 to 140, or sometimes it can be about 100 to about 160. Depends whether it comes to. Usually, Mayan, 120 to 160, yes, per minute. Okay, great. Let's continue. I'm going to teach you something. I'm not going to be able to tell you what's the best recipe to cook, because quite a lot of you are having home cook, all right? So I'm going to teach you or to decide what kind of ingredient. Because what happened is, to us, management of food, right? Okay, this is the study that I pull out from the paper or from the internet, is that dietary supplement can actually help the dogs or the cats that have CKD live at least averagely about 13 months longer. That means if you're feeding the right food to your pet that has CKD, or even senior cats or senior dog, you can actually lengthen at least 1 year of their life, even though they are with CKD. All right. Okay, this is for a therapeutic purpose. Okay, you can take this one down as well. Okay, how much of recommended protein? I will also discuss today a little bit, right, about the controversial of feeding a lot of protein or lesser protein, or what kind of protein that we're supposed to feed. All right. Okay, generally we want it to be low. Okay, we want it to be low, about 25% or so. But most of the therapeutic diet that you see, right? Like, okay, I'm not related to any one of the company, yeah. So I'll just throw out names, but most of the time, is something that you're familiar with, okay? Things like KD, things like renal diet from breed, renal diet from RC will also have all these specific prescription diet. Prescription diet means if your cat or dog has kidney problem, then this diet is supposed to help them to reduce all this toxin. Okay, and why we use this commercial diet, to be very frank, is very easy. Okay, it's very easy. Why? Because it's very, very convenient. Yeah, you're right. So Sim asked a question, does the nutritional profile, right, differ for cats and dogs? Okay, most of the kidney cats and dogs should be getting almost the similar figure like what is recommended lah. Okay, and it is the commercial diet, this is what they get as well. Sometimes the cats would want to get a higher level. So I'm going to discuss with you today, right? This is a very new thing in the market lah. Very new thing in the market, whereby whether last time for many, many, many years, we want to tell everybody that low protein, low protein, low protein. Then we realize, right, if you really have low protein, okay, but you didn't give a very good quality protein, it's still bad. All right. So I want to tell you the objective of restricting the protein diet, right, is to reduce the waste amount. Okay. Protein metabolism means you eat protein like eggs, like meat, different kind of meat, fish. Okay. You eat inside, so the body will process, and after process, then you get absorbed into the intestine, and then it gets into the blood. Okay, absorbed into the intestine and goes into the blood. Okay, so yeah, like what we say now, the new way of doing is that we want to give good quality of protein instead of only restrict protein. We want to restrict protein, but we want to give good amount of protein. So what the commercial diet is doing now is that they give quite a good percentage of protein, like what you see just now, 30% over. But they give a protein that's so good quality that it can actually be absorbed and lesser waste that it will put out. Okay, then you will say, oh, how do I know whether which one is good protein, which one is not? So instead of having definitely, to be frank with you guys, don't report me anyway, please. That actually cook fresh food, it's definitely always better than processed food. But don't only quote me one thing, but can you put me up? But what happened is, if you cook, but you didn't cook in a very proper nutritional way, then it's bad for your pets. All right. So some people will say, oh, I cook for my dog, very healthy, very good. Then what they do, they only give chicken breast. And after that, they think broccoli can, then they put some broccoli. And then they say, "Aya, shit, my dog or cat don't like broccoli. I put carrot lah." Or some even like, my cat don't like all this. Cat and dog should be cat should be carnivorous. Let's put only protein. Let's put only chicken or only beef. You know, all of these might not be able to help your pets. Other than that, it can actually harm them too. Okay, so today I want to tell you that how we can actually choose some ingredient, because you are how to say, cooking for them. I have actually done some research and gather something. So other than giving very high quality protein source, we have to also give a lot of we want this amino acid. So there are some multivitamin that actually have amino acid inside too. Okay, so the protein source, what you get is, if you can get fresh meat or fresh fish, or either chicken or beef and all that is fine too. Then later on, I'll tell you also what is the phosphorus content or what's the protein content that you can get in those different kind of food. All right. So protein, what we are going to do is the percentage of protein we have talked about. We wanted about 25%. So if you are really feeding them, you can actually do that. You can even, let's say if you're cook for them, you can even go up to 35% of protein. Okay, for dogs and also for cats. Cats can even go up to about 35 to 40% of protein too, because they are more carnivorous. All right. Now, so other than that, other than protein that we need to do, so okay, before we do phosphorus, can I know whether you understand that now we are not talking about only restricting protein. Okay, let's say if you cannot go on commercial diet, or let's say you have a mixed diet. Just now, there are some of you guys, right, are saying that you give this commercial diet, and then you also cook for them. If you have kidney problem dog, right, or cats, right, then you can actually give your renal cat, your KD cat, your renal dog, or the KD dog for your dog, and then you can add in the protein or the other cooking food for them as well. Or you can actually separate into two different meal. One is a fresh meal with a good proportion of, let's say, beans, and then veg, and then your protein that is about 30%, right? You can actually put that. All right. But most of you sometimes give almost 100% of meat, not much of other things. So do look into that as well. All right. Okay, now we talk about, if you can understand, press 1, please. And then those that cannot follow at all and wanted to ask me question, please press 2. Okay, can oh, very good, very good. So phosphorus restriction. Now, a lot of us cannot really differentiate. Even myself, it's very difficult to count. What's the difference? Protein, it's usually break down into urea and creatinine. Okay, phosphorus is another toxic metal that you are supposed to push it up. All right. So what if I'm feeding half kibble and half home cooked diet? Do I still need to give 25% of protein? Yes. So what you do is your home cooked, your kibbles, right? Your kibbles, you choose the kibble that is renal or KD. And then after that, the other time when you actually prepare your food, you can put your 25-30% of protein in there. Meaning to say that you have two different meals, right? Is that what you mean? Okay. If you're telling me that you are generally giving all the kibbles and then you only put some pumpkin or some carrots for fun, then as treats, then it's fine. Then you don't really have to put that 25% of protein. If your food is already like enough energy and enough portion for the whole day, all right? But let's say if the day for the dry food, right, is 100 grams, but you only give 50 grams, and then the other half of it, right, you're actually replacing with your home cooked food, then you have to make the proper portion of the home cooked food with the meat and veg, okay, together. So phosphorus, okay, phosphorus, this trial, I think it's quite interesting, because they actually have this kidney disease. They get these 24 dogs that induce the kidney disease. then what they do is they put in 32% of protein, the same amount of protein, okay? But they don't do any phosphorus restriction at all over 2 years, okay? All of these cats and dogs on the high phosphorus diet have lower surviving rate. So not only you look into protein, you must look into phosphorus as well, restricted phosphorus as well. All right. Okay. So the third thing that you need to pay attention to is the omega-3. Omega-3 fatty acid. Okay. What is that? What is that? So the EPO, the evening primrose oil, the flaxseed oil, sometimes the coconut oil that you actually get right from the pharmacy or even the vet. Actually, those are the how to say, the EPA and DHA that you are looking about. Is actually the omega fatty acid lah. All right. Salmon oil too, yes. Salmon oil can also be one of the omega fatty acid. So what we want to do is, I want you to look into this. It's 40 milligram per kilogram of EPA. It's actually quite fish oil as well, Che. Fish oil as well. So what you want to do is, can you calculate for me, okay, whatever your dogs and cats body weight, can you actually calculate how much of this EPA and DHA? So what you do is, we put it, sometimes they have the EPA on, then sometimes there's the DHA. Sometimes what they do is, they just tell you that EPO, how many milligram, okay? So let's do this. Usually they will combine. So let's do it as 65 milligram per kilogram. Okay, 65 milligram per kilogram. Now you know that how heavy is your dog and cat, right? Who doesn't know their dogs and cats' weight? Okay, who doesn't know their dogs and cat weight? Who knows their weight? Say yes. Or you weigh them every month. That's very good. Actually, you should. Yes, everybody knows their dogs and cats' weight. You know, in veterinary medicine, right? The dogs and cats' weights are very important. So now what you do is, now you calculate for me 65 mg per kg. Okay, times whatever weight that your dogs have. Okay, come up with how many milligram that you need. Put it in the chat box. $260,195. Okay. Okay. So what you want to do is that, do you know what is the commercial capsule is? Have you given any of these omega-3 and 6 for your pets? $250. Sometimes $250, sometimes $500. Okay, sometimes $1,000. All right. Great. So what we are looking at now is that if you 2,400 2,400 milligram is possible too, you know, if the dog is 30 kilo, right? 35 kilos. So what you do is, if you check with your EPO, the normal EPO that we get, right, it's about 250 to 500 per capsule. All right. So next time when you want to give your dog supplement, do look into this. You can actually take a photo of this. Usually for dogs and cats that is having CKD, right? We will need this dose. If we want the anti-inflammatory dose, then we probably will be more high, like higher dose. Okay. For anti-inflammatory dose, we can go up to 250 milligram per kilogram. So don't worry about overdosing your pets with omega-3 and 6. Okay. Great. Now, next, what you do is, please don't use salt. Even though sometimes in some cases, right, salt is useful. Usually we can even like in 2 days meal, we can sometimes give about 1/8 teaspoon of salt sometimes. Won't get soft stool. Okay, if you get soft stool, right? Okay, to be frank, Che, overdose is not going to happen with this dose. Okay, this dosage is very, very, very safe. If your dogs or cats is actually having a soft stool with this dose, meaning to say that they can't take that kind of oil. Okay, so maybe you want to use for another type. Okay, another type of oil. So let's say flaxseed oil you can't, then probably you use EPO. If EPO you can't, then probably you use some other thing. Sometimes it's the capsule that is causing the soft stool, not the oil as well. So sometimes if they are having soft stool, you might want to just cut it open and feed the oil only instead of the capsule. Okay. Is black pepper good for dog? Won't really comment here. But generally, there are some school of thoughts that says that black pepper is good. It depends in a very distinct amount, I would say. I can't answer you here because I don't have the dosage right to tell you here, Audrey. Okay, I apologize. So lean meat. Okay, what you do is you use lean meat instead of fats. Okay, and then a lot of fresh water, in different area, especially cats. All right. Kidney supplement usually it depends on what kind of kidney supplement that you're talking about. Definitely, if kidney supplement is actually to give a lot of oxygenation to the kidney, make sure the kidney doesn't have the pH of the urine is always right, so that you don't have the stones and all that to start to get the kidney issue, or something to help generate kidney cell, then it's fine. Okay, renal N and renal P is very different. Okay, renal N and renal P is actually a probiotic. Renal N is actually a probiotic to bind the creatinine when the creatinine is high. Renal P is actually the phosphate binder. So when the phosphorus is too high, the renal P is there to bind in and push it away. Okay, so that is already a treatment wise already, Kenneth. I think if you are on that kind of supplement, already on treatment. All right. How much of water a dog should be drinking per day? Usually it's about 5% their body weight if possible. Okay, so 5% of body weight, how you do. So let's say a 5 kilo dog, a 5% body weight will be 250 milliliter, 250 ml. Okay, 250 ml. 250 ml is okay. A 7 kilo dog, need a cup, like a cup of Coke. The how to say, the canned Coke. Canned Coke is about 325 ml. Okay, so the 13 kilo dog yes, 500 ml, not too bad. You can actually go up to about 650 to 700. So it's always about 5% of your body weight should be good enough. Definitely, if you are talking about a 35-kilo dog, they can't really drink up to like 2 liters of water lah, but sometimes they do. You have to prepare 2 liters of water no matter how, okay, for a 35-kilo Labrador or Rottweiler, okay? If they really can't, then you at least you have to actually encourage them to drink. Why I want you to put in a different area, because for cats, especially for cats, they don't want to just stick with one place. They get bored. Okay, they don't like that place, then they don't drink anymore. All right. Oh, I see. I've passed the time. Come next. So protein source, I have done a little bit of research for you guys. So usually, what you do is like, let's say for cats, right? If your cats like to eat fish, it will be better to give fish than meat. Okay. Meat like chicken and beef will have about 170 milligram per 100 gram. So you're not really feeding only 100 grams. So accumulatively, you will get actually more lah. So if your dog like fish and not allergic to it, you can also use fish if your dog have a kidney issue. All right. And then for others, right, is the protein level in the meat. Okay, so you can also take a photo of this just for reference. Is too much water bad for dog? How much is too much? Usually, if a very well hydrated, how to say, a dog can actually drink and produce urine properly, water shouldn't be bad for dog. Okay, too much water shouldn't be bad for dog, because in the condition of they can drink properly and produce urine properly. That means whatever excess that they drink, like you lah, you're very healthy, right? Whatever excess that you need to drink, then you pee a lot long. But if your dog normally just drink that one bowl of water, then suddenly like now every time like afternoon already empty, you have to pour. And then evening empty again, you have to pour. Something is not right. Suddenly, if your dog is drinking a bit too much, then it's not good. All right. Then you have to bring to the vet to see that whether your dog is sick or not. So kidney problem will have that, polyuria polydipsia. Diabetic patient can have that too. Sometimes some uterus infection can get too. Okay. So it's something serious if your dog suddenly drink and pee a lot. So this one you can actually take a photo as reference. So then you will know, right? How much of protein you get from all these different sources. All right. And then next. Okay, vegetables. Take this one down as well. Can take a photo. Whatever that is low in phosphorus, this one, to be very frank, I don't know much. I actually Google it up and this is what we get. And I take it down on whichever things that your dogs and cats can eat. Okay, like cabbage they can, asparagus. So cabbage sometimes gonna be too high in sugar level as well. So sometimes it will cause diarrhea. So if they don't really like to eat, they are okay with lettuce and spinach, you probably can use that as well. Green beans, carrots. We seldom give radish to pets. If you choose cauliflower and even broccoli should have higher phosphorus than cauliflower. So if your dog is having kidney issue, instead of feeding cauliflower, instead of feeding broccoli, you can actually choose cauliflower. Okay. Celery are not particularly low though. I've actually gone through it. It's not particularly low. It is not at the too high level, but it's not particularly low. So if your dog already have kidney issue, then I would say probably use others. Yeah, pumpkin is no is also not one of the very low phosphorus one, because the phosphorus level for pumpkin is still average, average, not low. Because what I want you to know is what is low, that when you choose it first lah. All right. So next, I think I'm almost done. Okay. So so what we conclusion in conclusion, please put it here. What we want to do is we want moderately low protein, but too low of a protein, right? Sometimes, especially cats, after a while, they don't get enough protein to be inside their body. They actually break down their protein from their muscle. All right. So what other than protein that we always look into, like, oh, we say we give less meat lah. Doctor say low protein means I give less meat lah, right? So not only less meat, you have to choose low phosphorus diet too. Okay, and then your sodium, sodium and potassium, it's there as well, but the table salt that we have is actually sodium chloride. Okay, if you can get, okay, put it down, this is important. If you can get a salt that is with potassium, you can use a little bit in the food. Okay, sometimes the organic shop might have. Okay. Okay, sometimes the organic shop might have this potassium. Why we need potassium more? Because when they have a lot of how to say food that is they drink a lot of water and then they pee a lot, they lost a lot of potassium. Okay, so when you, in your kidney patient, if you want, you can use the salt of potassium chloride instead of sodium chloride. Sodium is NaCl, potassium is KCl. Okay, I think I typed it down for you. NaCl. This is no, and then the one that you get is KCl. Okay, if you can get KCl, you give a little bit. All right. So I just try to not only give you this, and then you should add in your EPO as well. So what you do is with all this, you can actually reduce the toxin in the body, so it can actually extend the lifespan of your cats and dogs. Okay, especially with CKD. All right. So then you want to ask me, doctor, if my dog and cat belum have kidney problem, then what happened? If my dogs and cat don't have kidney problem, then what will you do? What should I be feeding? What should I be feeding if my cats and dogs is old but don't have kidney problem yet? So what will you be feeding? So what will you be feeding is good quality protein with high with the 40 to 65 milligram of EPO if you can. All right. Even without kidney problem, you can actually already start doing that. Okay. Then you don't have to pay so much attention to the phosphorus part. All right. Prevention is better than cure, you're right. So if they are on commercial diet, then what you do, you put them on the senior diet. Okay. If you want to see that if you put them on the senior diet, comparing to the puppy diet and the adult diet, you will realize that they also have slightly restricted protein. Okay. the percentage of the protein usually will be about 25% or so instead of 35 or 40. Okay, but if you're giving a renal diet and all that, you see, why doctor tell me very low protein, but why are these commercial diet are higher in protein? It's because they have a better quality protein. All right. EPO or EPO is evening primrose oil. You can use EPO, you can use flaxseed oil. Yes, as you can use coconut oil. What oil do you use? Fish oil. Okay. Then the dosage is about 40 to 65 milligram. Okay. Great. I think that's what I want to tell you today. I just gone through the cauliflower and pumpkins. Pumpkins definitely has a lot higher protein. It's about almost double the amount of the protein and the phosphorus. Okay, I just look up. Is duck meat high in phosphorus? Or you like to give duck meat? Duck meat it's if I'm not mistaken, is around the same as the chicken as well. Okay, so chicken as well. Duck bone, yes. The meat is actually around the same as the chicken and beef. Okay, great. I think I want to tell you, I know today's class is a bit boring, okay, because I don't do too much of this fun stuff for you guys, but I hope you guys learn something. How about food? Fruits actually, to be frank, if you only give it as treats, right? Yes, blueberry is quite good. Blueberry has a lot of antioxidant. Okay, it doesn't have too much of phosphorus and protein as well. Blueberry is a good choice. Actually, even apple is okay. Try not to give citrus fruit as still. Okay, pear is not too bad too. Pear is not too bad. All right. If you want, I can compare these berries and pear for you. But all of them, they have negligible phosphorus and protein too, comparatively. Okay, so if you try not rice is mainly carbohydrate, so you don't have to be too worried about the protein. So if you can, senior dogs and cats, or Momo is here. Senior dogs and cats, right? We don't really how to say, senior dogs and cat, if you can, try not to use too much of rice as well. One, we worry about obesity. Second thing is sometimes it causes a bit of bloating. Okay, everyone, this is Momo. Hi, Momo. Momo has a very good story. Momo is a cat that comes to us, fell from 15th floor. Okay, I'm sorry that I took a little bit longer of your time. I'll promise I will finish by 10. So Momo come in, fell from 15th floor. He has 4 legs, right? He actually break 3, and also the pelvis. Okay, so but now today, because that's why we always want to give them a chance whenever they have problem. So we give him a chance. Owner can't afford to treat him. We give him a chance because he was only about 2-3 years old. Now he has been with us for more than 5 years. So he's about 8 years old now, I think. 7-8 years old now. So he survived 3 different surgeries, and then he can walk now, and he roam around our office now. All right. So I just want to teach you how to do the hydration status. So this is the cat face. This is the neck. So what you do is you pull, you drop. After you pull, you drop. It goes in right away, right? Okay. So this is good hydration. If you pull already, it stays like that, and then it slowly come down, then it's dehydrated. Okay, got it? So you can actually try with your own pets at home. Try to do that and see whether you pull already. Oh, you pull already, then you let go. You see, it comes right down. Poor Momo. Usually he don't let me do this. Say goodbye, good night, everyone. Okay. Yeah, now he can walk and we are very happy. So everyone deserve a second chance, okay? Right, great. So thank you very much. I'm done for today. If you have any question, I'm happy to take. I'll still stay here for about 10 minutes or so. You have question for your particular pets, please do so as well. And then I'll pass back to Sabrina. All right. I'll pass to Sabrina and then I'll take your question and answer it later. So far, Apoquel, I'm answering the Apoquel question now. So far, Apoquel is quite safe for long-term usage on kidney and liver. All right. Very good question. How to prevent pancreatitis in kidney dog? Pancreatitis usually happens by feeding very fatty food. All right. So if you can, EPO and all that is actually good fats. It's not bad. That's why you feed lean meat. You don't feed fatty meat. Okay. So if you feed pork, please feed lean pork. Don't feed fatty pork. Okay. How to prevent kidney disease? Sim, I think I have tried to done that. Commercial renal diet is very easy. It's good. Subcut, yes, you can do. Is that sufficient? A regular checkup would be better. Okay, and definitely we have a lot of supplement like what we say just now, like Azodil. Things like Azodil, which is a probiotic, and then the phosphate binder. So you will have to check your blood test and see whether the phosphorus is high. If the phosphorus is high, you use the phosphate binder. If the phosphorus is not high, you don't. Okay, great. Audrey question is that good diet for our dog is same as human, just switching the position of carbs and protein. I don't really understand that. What I mean is dogs and human are the same. They're actually omnivorous, not like cats. So what you need to do is, if possible, we don't encourage too much carbs for doggies as well, because especially the cooking carbs from us, right, cause a lot of bloating. And then if that's the case, and then the fats as well will cause things like pancreatitis. Okay, I hope I answer your question. Will dental stick increase risk of CKD? It really depends. Okay, it really depends. Some of the dental stick has very, very high protein. If you are feeding it every single day to an old dog, it might not be too good of an idea. So what you do is you choose the one with less protein, less phosphorus. Okay. Okay. Right, I'll pass it to you, Sabrina. The off-topic question, I might not be able to answer you now because it won't be fair for others. And then I'll pass it to Sabrina. I'll try to PM you later. Okay, Sabrina, here go.
Okay, thank you so much, Dr. Lee. I just want to say that, thank you for squeezing your time. If you guys know Dr. Lee, she owns her own clinic and she works 6 days a week. And today she fly back from Penang. She also get to meet with PC, his cat hotel. So we're really thankful. If everyone, feel like they learn a lot today, please say thank you, Dr. Lee, just thank her. and just take your time and say, you know, how well, you know, you have, how grateful, you know, to have her as our speaker today, because it was very rushing. I think she left her luggage because she rushed here, just to make sure that, you know, the webinar has been going on, as she promised. So please don't leave yet. Give me 1 or 2 minutes. Is that okay with you guys? Just 1 or 2 minutes. I'll just keep it short and very simple regarding about this platinum membership. Okay, as you all can see, right, from the sharing screen. Okay, platinum membership, right, is worth a lot of value for people who are like you and me. We are pet owners. Okay, we need to be feed with knowledge, because prevention is definitely the key. You know, like you guys said, right? It's better than cure, any kind of cure. So definitely knowing what to feed and how much to feed your pets, nutrition wise, and also how to say, a lot of common emergency that we can prevent as a pet owner, and we can be the one doing the first aid, right? So it actually makes a huge difference. So I want you to really understand the value that we are providing. So as a platinum membership, you get 6 free talks in a year. So totally free for you. The recording you can play back. You know, you can just access in the portal. Just put in your email, put in your password, then you can access to everything. And you can also have the slides as well. We provide the slides as well. So actually one talk, you know, actually worth around 50 ringgit ma. So you times 6 is actually 130. So if you're taking this platinum membership totally free for entire year, you get Shopee cash vouchers, and also our own product that has been formulated by Dr. Lee, our DMG, and also our paw spray, a pet friendly spray will be given to you as well. And this is worth 173. It is actually very pricey. And definitely you get to be in our pet community. Our Pet Heroes community is for exclusively for members only. We have private Facebook live talks. We have gathering every year with Dr. Lee as well. We have charity program, and recently we're gonna upcoming one is the vaccination charity program. They're gonna help a lot of animal shelter to get vaccinated. We also have physical classes as well. So be sure you stay in our community and get all these values. So these 6 live webinar, right, is tailored to your needs. Like let's say you guys feedback to us, I really want to know about, you know, one of the Pomeranian club owners say, like, I really need to educate my member about trachea collapse and also reverse sneezing. Like, how do we take good care of them, or how do we prevent that from happening? This is the talks that we are going to tailor for you. And also a lot of skills and techniques on basic first aid and info pack. And definitely, like, Dr. Lee gives a lot of knowledge to everyone who's here, you know, like she makes sure you count every single body weight to know the correct EPO, omega-3 for your pets. And definitely, you know, is reliable source, as she is our own instructor, our only instructor. And also you have a membership portal that you can access any time of the day as long as you got Wi-Fi. In there, inside there's a lot of bonus webinar, a lot of pet health talks, like common emergency prevention, how to help if your dog is very fearful, or a lot of webinars, previous webinars that we're going to put in, and there's welcome gift, and also a lot of added benefit, because we have many sponsors lah. Yeah, this one is also our product. Okay, and these are all of our sponsors, including Breed, Royal Canin, and also Mini Hero. So all of them, they chip in a little bit of a surprise gift for you when you join our platinum membership. So we used to sell this at 279, and now it's only 219 for a year. Okay, so if you're interested, please PM me. I'll be on standby. Let me know that you're interested. You can scan this QR code as well, and then you can visit our our page, and you can see all the benefits being our platinum member lah. Okay, so thank you all for today's. Thank you so much, Dr. Lee. I really enjoy it, and I personally learned a lot, like a lot, and it's very beneficial. You know, becoming a pet owner is not easy, we know. So we don't journey alone, journey as a community. Okay, so that's all from us. Please on your camera, on your video, so you can take a picture together.
I'm sorry, I just tell whoever that asked me question just now, right? I was answering your
Dr.
question
Lee,
in the
you didn't on your sound. You have
yeah,
to
I
on
did
your
not.
volume so we can hear you.
Sorry, you cannot hear me?
Cannot hear you.
No. Hey, can you hear me? Everybody can hear me except you. Oh no. Okay, great. Now I just
Okay.
want to tell you guys that I was answering your question in the chat room, right? Please look into it. The one just now that asked me about the metimazole, I think is a very important question. I think her cat must be on that medication. So metimazole is it's a drug, it's a medication that might cause kidney problem, but what you do is you just keep closely monitor it lah. Okay, all the others that I will go through it. If you did ask me question, you can actually just stay on for a little while. I will answer it in the chat for you later. Okay, right, let's take a photo and let everybody go home first.
Hello. Hello,
Hi.
Curly. Hello, Pixie. Oh, hello, Justin and his cat. Ayo, so cute.
So beautiful. Great.
Hello, everyone.
Hi.
Okay, we're gonna take on 3. Okay. Everyone ready? Like on your camera. Oh, hello, Yamuma. Hello, Sue. How about An Yuan and Yuri? Daphne also, please, if you can on your camera now, it'll be good, so we can see your face and also your dog and your cats together. We take a picture.
Right.
Okay, ready? 1, 2, 3. Again, one more pose. 1, 2, 3. Nice. Thank you,
Thank you so much,
everyone.
everyone.
Thank you so
Thank
much.
you.
Okay, have a good night rest.
Good night.
Bye-bye.
Bye-bye.